there's a lot of anger about what happened to him, how he was treated, and the injustices that really are happening in our country. Still, I'm having people write me every day. I receive more messages of people who are sharing their stories. There's people who are commenting on our fundraiser page. There's people who are messaging me personally saying, I'm in the same situation as your husband, or my mom is in the same situation because she's being denied an organ, and it's because she's not vaccinated, and all of this stuff. So it's a very real problem in our country, and it is scary because we are talking about an experimental injection. That's still what it is, because there is not sufficient research, and there won't be for at least 20 years.
Well, the science has changed with one hospital who imposed indiscriminate COVID-19 vaccine mandates onto patients seeking organ transplants, but not before an absolute tragic and preventable loss of life occurred. And I have a recording with the senior media relations consultant of that same hospital for the consensus to prove it.
And in the meantime, there's been people who have been denied, in one instance, specifically a referral for this program based on a policy that happened to be the same month. And I don't know exactly which day, if it was before or after the unfortunate passing of this individual. But I find that a bit interesting that the same month your policy changes as this gentleman dies.
I can't speak to what gentleman you're referring to. I'm not at liberty to talk about individual patients.
Tamara Ugolini here with Rebel News, and in today's report, I'm going to show you how one hospital's revolving door of evolving science has resulted in the medical discrimination of at least one patient, Garnet Harper. Garnet was an otherwise healthy, young 35-year-old married father of 5 adoring children when he was denied a referral for a kidney transplant by the London Health Sciences Centre via email sent by transplant coordinator Peggy Kittmer. His wife, Megan Harper, previously joined Rebel News to discuss the medical discrimination faced by her husband and how his family is coping in the aftermath of his preventable death. Megan said that Garnet was an otherwise perfect candidate for organ donation, and he had his 2 biological brothers volunteering to see if either were a good match. But all of this fell on deaf ears by those responsible for gatekeeping socialized medical care. And to add insult to injury, while Garnet was on his deathbed, Megan was asked if he wanted to donate his organs to the very same organization that he was being denied referral to. I will link to that previous interview that includes some of the previous hospital communication in the written component of this report. Because the focus of today's report is how the hospital went behind the scenes and changed their online policy and FAQ documents only after my media request was sent on July 25th. See, according to the old form, it read the following on and before July 25th of this year. Multi-organ transplant program in London requires that you have at least 2 doses of an approved COVID-19 vaccine before being listed for transplant and encourages you to get 1 or 2 booster shots when offered to you. If you are on the waiting list and have not yet been vaccinated, you will be placed on hold until you can get 2 doses of the vaccine. You should be vaccinated with those 2 doses at least 1 week before your transplant, and further doses given after your transplant. It is better to have booster vaccines given before you are given anti-rejection drugs to improve the protection. Exceptions to required vaccination are considered, and you should discuss this with your transplant doctor. Furthermore, it says that every recipient is unique, and there may be cases where vaccination is not possible. Your transplant team will consider your situation, and medical exemptions may be allowed. These exemptions are the same as those that the Ontario Ministry of Health has listed. Other exemptions include recipients who are too sick at this time to be vaccinated and need the transplant immediately. Children do not need to be vaccinated to be listed for transplant. Then why did Kittmer say that there were no medical or surgical exemptions to receiving the vaccine? We don't know because the specifics of my media request, like that very question, have not been answered. And plus, at some point, Garnet Harper would have been too sick to get vaccinated and would have needed a transplant immediately. So why was he not considered under that stipulation?
How in the world could such a small group of people with limited resources change world history? But in fact, that's happening, and it's the power of the truth. The truth is like kryptonite.
Healthcare isn't in some sense working very well. Foster Colson is thinking about this. He's got a new company, an online healthcare platform called the Wellness Company.
Telehealth company called the Wellness Company.
The Wellness Company.
The most popular product is the detoxification supplement that features nattokinase. Nattokinase is the only enzyme that we're aware of right now that dissolves the spike protein. Spike protein is loaded in the body with the COVID-19 infection and definitely with the vaccines. We've been completely accurate on the spread of the virus, early treatment, on the deficiencies in hospital care, and now the deaths that are occurring after vaccination. This is a human outrage, and it's occurring at the end of a hypodermic needle. Isn't it interesting? Natural substances combating this man-made disaster.
But now, this is what the FAQ states. Yes, the vaccine will help protect you from more severe illness if you get COVID-19. If you do not get your vaccine until after your transplant, the chance of getting a good vaccine response after transplant is much lower. This is because you will be on anti-rejection drugs that lower your immune response. Like most other vaccines, the COVID vaccine is much more effective if received before transplant. It is recommended that 1, all patients receive a Health Canada-approved COVID-19 vaccination before being put on a transplant waiting list. 2, patients' close contacts should be fully vaccinated. And 3, in the case of a living donation, donors receive vaccination against COVID-19. There's no more wording of a requirement, but rather now it's a recommendation. Likewise, the new document doesn't stipulate exemptions at all, likely because there is no longer a COVID-19 vaccine requirement or mandate in place. After my previous report went out, Steve Robinson, the senior media relations consultant for LHSC, asked me to give him a call. I'm going to share that recording here with you now. Have a listen.
So I'm just following up on the email that you sent to me on Friday asking me to give you a call.
Oh, that's right. Yeah, just about your article. Yeah, we're just a little disappointed with that, given that some of the facts are incorrect. And, we were just going to try to correct them, but it's probably moot.
Okay, no, I would absolutely love to correct any inconsistencies or discrepancies in there. Can you tell me what exactly was incorrect?
Yeah, so Peggy is not responsible for setting the policy in any way, shape, or form. So that's incorrect. She doesn't do that, right? It's a committee here at the hospital that would have to do that. She just communicates it. So it's kind of unfair to put her in that position.
Sure. Who's all part of that committee?
Well, that I can't talk about at this point, but if you wanted to submit a request, I could start fulfilling that for you.
You mean a Freedom of Information request, or?
No, a media request. If you want to send me one, I can go through the email again and go through the same process. I'm quite happy to consider those things. I did respond to you, too. It wasn't a back and forth. If you recall, we did have some discussion. I did send you an official response.
Eventually, yes. There was 2 emails prior to that, which
took a little bit more time, yeah.
Which is a bit of a back and forth in and of itself, given there was 2 emails before that formal response. What is the name of the committee then that's responsible for this policy?
I don't know offhand here. Hold on. But if you submit a request tomorrow, I'll be happy to start that process again. Okay.
So if I word it,
Peggy. So
if I word it very benignly, that there's this elusive committee involved with denying the organ transplant referral of unvaccinated COVID-19 patients, you'll understand what that's getting at?
Yeah, but it wouldn't be accurate to state it as such. But if you want to state it that way, sure. But my response will be in that context.
Okay, so you can't tell me the name of the committee or the people on it, but if I submit a formal request via email, then you can respond?
Yeah, but I'm not a spokesperson. I'm just a person who's helping you get the right information and quotes if you need them. So just submit it to me and through our media line, and I'll prepare statements for you.
Sure. And then I also wanted to clarify as well that I didn't state in there that Peggy was responsible for the policy. I stated that an email came from Peggy, which reiterated the policy. So I don't know if maybe in a roundabout way.
The nuance was clear, and I did defend that. here saying that that's not quite what you said, but the implications are that. So it is unfortunate, but I just want, that was the nature of the conversation I called about.
Okay. And can you just clarify for me when exactly this policy was changed?
Yeah, May of 2023.
Okay, so I actually pulled the exact quotes from that document, this COVID-19 vaccination information for transplant recipients, on either July 24th or 25th. And so at that...
I appreciate that. Yeah, we did update these documents. So what happens here is the patients of LHSC will receive direct communication from us. We don't rely on our website to communicate with our patients, so they're well aware of what the policy change was. The FAQ, unfortunately, wasn't updated during this call, and we don't receive a lot of calls about transplant policy connected with COVID. In fact, it was very rare to get that call, so your call was the first, and we did notice an error.
Oh, I see. So thereafter, you spent time to correct that online form?
That's correct.
I see. And then what was the reasoning or the scientific rationale used to change the policy in May?
Well, the science had changed. More people being vaccinated. The fact that, that's just basically the case. In my original statement, as you recall, we had indicated that the transplant recipients are more susceptible to death from infection, right? You have to appreciate that. They're on immunosuppressants. So it's not just COVID, right, that they're susceptible to. They could be susceptible to any kind of infection. That's important to keep in mind, right, that the transplant recipients, once they receive an organ, have to have immunosuppressants in order not to reject the organ. And that makes them susceptible to all sorts of viruses and whatnot. So during COVID, of course, we had the stipulation that you have to be vaccinated with COVID.
Yeah, the double doses. But now we know that the injection does not prevent transmission or infection. So is that where the science changed then?
I can't speak to that.
Okay. And in the meantime, there's been people who have been denied, in one instance, specifically a referral for this program based on a policy that happened to be the same month. And I don't know exactly which day, if it was before or after the unfortunate passing of this individual. But I find that a bit interesting that the same month your policy changes as this gentleman dies.
I can't speak to what gentleman you're referring to. I'm not at liberty to talk about individual patients.
Right, of course. And I respect that there's privacy involved. Which day exactly did the policy change in May?
I don't know offhand.
So sometime just in May of 2023, the policy was decided, the science had changed and therefore the policy was updated?
That's correct.
Okay. So if science is evolving and changing, how can you justify this?
I'm not at liberty. I'm not a spokesperson here, so I'm not at liberty to discuss. That's the other thing. I'm not a spokesperson. I'm the media relations consultant. If you want to submit to me a formal request, I'll begin to answer your questions. Endeavor to answer those questions for you.
Okay. It's been
or have a spokesperson that is qualified and to speak to you about these matters.
Absolutely.
If that's what you want. So.
It's been nearly a week, and even some of the original questions I asked you were not answered in your very generic, I think it was two sentences.
Because we're not able to talk about specific cases.
No, and I didn't ask any specifics. I asked very general, generic questions about the science and your policy. But it seems that those things can just change willy-nilly, and it doesn't matter so much if people's lives were affected in the midst.
If you submit a request to me through the email, media@lhsc.on.ca, I'll be happy to discuss that with you.
Okay.
Despite having the senior media relations consultant on the phone directly with me, I have since sent another media request via email so that the committee can be consulted for a parroted consensus response. I asked the following: who comprises the committee responsible for Peggy Kittmer's email denying organ transplant referral? What is the name of the committee responsible for this decision? What is the exact date in May that the COVID-19 vaccination information for transplant recipients document was updated? And what role does Corinne Wiernik have in the above mentioned document? That fourth question I asked because the document properties on the updated FAQ show Corinne Wiernik as the author. Wiernik is shown in this photo and captioned as the transplant donation specialist at LHSC. And according to the website, the FAQ document was updated on May 19th, despite the fact that Robinson was unable to give me an exact date, which was 3 days before Garnet Harper passed away on May 22nd. Did the hospital ever let anyone of Garnet's family or his wife know that their policy had been updated? As a result of my investigation, Robinson responded that London Health Sciences Centre will not be responding to further inquiries on the topic. So I suppose the secret committee responsible for Peggy Kittmer's email will remain undisclosed and all of my other relevant questions unanswered, especially that exact date of the policy change. Was it before or after Garnet Harper succumbed to his fate? How's that for accountability and transparency from the socialized medical system that we all pay into? For Rebel News, I'm Tamara Ugolini. Coercively mandating COVID-19 vaccination for organ transplant recipients is exactly why we've launched a campaign and petition at organsnotcoercion.com. If you agree that this is a grotesque overreach and unethical way of conducting medicine, then please head over to that website to view all of our reports and sign our petition geared toward each provincial medical officer of health responsible for the regulations that resulted in these mandates. That's organsnotcoercion.com.